Hello and welcome. You are watching the Trey Hart Learning Channel. Today on the Trey Hart Learning Channel, I am going to be doing one for my nursing colleagues, and this is simple blood gas interpretation. Stick around. Hello, you are watching Simple Blood Gas Interpretation with Ray Upchurch. To understand blood gas interpretation, we have to know what our normal values are. You will notice, however, that I do not include the normal value for the PaO2 or oxygenation. Today I'm going to talk about the normal values of the pH, the PaCO2, or the HCO3. The pH is 7.35 to 7.45, going from acid to alkali, respectively. The PaCO2 is 35 to 45, going from the alkali to the acidic side, respectively. The HCO3 is 22 to 26, going from the acidic side to the alkali side, respectively. So a good, easy way to remember this is just remember your pH, which is 7.35 to 7.45. Take off your 7s, and you're basically going to have your PaCO2, which is 35 to 45. And also, another easy way to remember your HCO3 is 22 to 26. Might be the ideal ages that some people would still like to be. So that would remind you of that. Now, one other thing to remember is that your pH goes from acid to alkali, while your PaCO2 goes in the opposite way. So it goes from alkali to acid, and your HCO3 goes from your acid to alkali. So basically your PaCO2 is opposite of your HCO3 and your pH. So let's get started. So today we are living in PH Town. Now the mayor of PH Town is a very nice person. If you move into the borders of the PH Town, basically 7.35 to 7.45, they will compensate you for your movement. Or if you break down in those areas, they will compensate you. But if you break down or move to outside of the town, basically they won't compensate you, so that's going to be uncompensated. And in this town, there are two movers. The two movers are respiratory, which is your PaCO2, and your metabolic, which is your HCO3. Now, in this town, how they determine who's going to pick you up is who's already closest to you. Basically, if your pH is acidic and you broke down the acidic side of town, and your respiratory is also acidic, then it's going to be your respiratory that picks you up. If your pH is alkali, then your metabolic, your HCO3, if that's alkali, then it's going to be your HCO3 that picks you up. So if you're picked up in the acidic side of town, it's acidosis, and if you're picked up on the alkali side of town, it's alkalosis. So let's do a few examples, and hopefully you'll see what I'm talking about. So today in PH Town, an unfortunate person has one of the pH has broken down in a postcode of 7.30. Basically, his pH is 7.30. So which part of the town is our pH broke down in? Well, the 7.30 is below the 7.35, and he's also left of the acidic side, which is, he's on the west side of the town, so he's on the acidic side. So basically, he's going to have an acidosis of some sort. So let's see who is going to pick him up. But he's going to have an uncompensated acidosis. Basically, the pH mayor is not going to compensate him for breaking down outside of town. So let's go see who picks him up. Well, today, our respiratory is 54. So 54, the PaCO2 is 54, so the 54 is on the acidic side of town. While our HCO3, or our metabolic, is 26. So basically, he's in the normal range of the metabolic. And so he's kind of in the center of town. He's not really on the outside of town. So we are going to send respiratory to pick up our pH, and this is what we are going to have. We are going to have uncompensated respiratory acidosis. So let's do another one and see how this is done. So today, our pH has moved into, another pH has moved into town, and that one is 7.48. So which side of the town is that one on? Well, that one's to the east of 7.40, so he's on the 7, so they are on the 7, on the alkali side of town. And is the mayor going to compensate them for moving into town? Well, they moved on the outskirts of town, so they are going to be uncompensated. So it's going to be an uncompensated alkalosis. So who's going to move this person into town? Well, today, a respiratory, the PaCO2 is 30, so that is on the alkalitic side of town. But let's check to see about the HCO3, or the metabolic side. Well, that's 24. Again, that is in our normal range for metabolic. So as the respiratory is the one that's closest, the respiratory is going to be the one that moves them. So it's going to be an uncompensated respiratory alkalosis. So let's do another one. Moved into town today, another pH is 7.30. Well, which side of town is that on? Well, that is on the west side of town of 7.40. And is it going to be compensated by the mayor or not? Well, it's 7.30, so it's outside of the postcode. So it's going to be an uncompensated acidosis. So who is going to have to move this person into our uncompensated acidosis side of the town? Well, our respiratory is 40, so our respiratory is in the normal ranges, so he's kind of in the center of town, hanging out in the center of town today. Our metabolic is 18, so our metabolic, our HCO3 is 18, so he's hanging out in the acid side of town today. So who's going to pick him up? That's right. It's going to be metabolic. So it's going to be uncompensated metabolic acidosis. Okay. So today, you are the dispatcher for the pH town. Which towing service are you going to call? So you're going to choose respiratory, metabolic, or both. Yes, sometimes the case is the new move-in is so heavy that both of them are required to tow them into town. And as we go through these examples, see if you can tell which ones are towed by both of them. So today, our pH is 7.50. Our PaCO2 is 40. And our HCO3 is 33. So, think about it. Which side of town is our pH going to be on? And then, what are our normal values? Is our respiratory closest, or is our metabolic closest, or are both of them close? So pause here, think about it, write it down, write down what you think. Okay, so let's go on to the answer. So it is going to be uncompensated metabolic acidosis, alkalosis even. Uncompensated metabolic alkalosis. Okay, so new to our pH town is a new one that's come in, and the pH is 7.35. The PaCO2 is 54. The HCO3 is 30. So who's going to move this pH into town? What do you think? Pause here, write it out, and let's see if you got it right. Did you get it right? That was compensated respiratory acidosis. So basically, they were moved into the center of town, and it was respiratory that moved them in. Okay. Next example. Our pH is 7.21 even. Our respiratory, our PaCO2 is 60. Our HCO3 on our metabolic side is 20. So who's going to move this person into town? So pause it, pause your video, think about it, write it out, and what do you think? That's right. If you said both of them, you were absolutely right. That is uncompensated mixed respiratory and metabolic acidosis. Basically, both of them had to move them in. Okay, so our pH is 7.54. So which side of the town is that on? And who's going to be closer? Our PaCO2 is 25. Our HCO3 is 30. So is respiratory, which is 25, or metabolic, which is 30, closer? That's right. They were both in that part of town, and it was a heavy load, so it was uncompensated mixed respiratory and metabolic alkalosis. All right. So here's a difficult one. So our pH is 7.40. And on the respiratory, our PaCO2 is 58. And on a metabolic, our HCO3 is 33. So who moved them into town? What do you think? If you said both, you are correct. Now, while both of these are out of sync, meaning your metabolic is in alkalosis and your respiratory is in acidosis, or vice, yeah, then it's going to be both of these that move them into town. So did you get that one right? Okay. Here's another one. So again, our pH is 7.40. Our respiratory is 30. Our metabolic is 18. Who's going to move that person in town? Pause it here and then think about it. Okay. Again, both of them are going to move them in. So it's a compensated mixed. It's a respiratory alkalosis, and it's a metabolic acidosis. So both of them, it was a heavy load, and based on both sides of the town, so both of them were called out, basically. All right, here's another one. So pay close attention to this one. Our pH is 7.40 again. So who's going to move them in? Pause here, write it down, think about it. What do you think? Yes, it would be both, but this is a normal blood gas. So it's not going to be compensated or uncompensated. It is a normal blood gas. Okay. So our pH today is 7.33. Which side of the town is it going to be on? And who is going to move it in? So respiratory, the PaCO2 is 40. The metabolic, HCO3 is 21. So who's going to move it in? Pause it here and think about it. Write it down. That's it. Okay, so it's uncompensated metabolic acidosis. All right. So today, our pH is 7.34. Our respiratory is 60. Our PaCO2 is 60 on the respiratory side. On the HCO3, it's 34 on the metabolic side. So who's going to move this person into town? Yeah, respiratory is going to do it. Now this is uncompensated, but most people might argue that it's partially compensated respiratory acidosis, and which it is. You can see that really high number when that respiratory is trying to hold on, and so he's just trying to compensate there, but not quite did it, so didn't quite get him into town. So here's our next one. 7.29 to 7. Our pH is 7.29. Our respiratory is on the PaCO2 is 32 on the respiratory side. Our HCO3 is 15 on the metabolic side. So who's going to move this person into town? That's right, uncompensated metabolic acidosis. So our pH is 7.52. Our PaCO2 is 28 on the respiratory side. Our HCO3 is 22 on the metabolic side. So who's going to move this person into town? Think about it. All right. So that was uncompensated respiratory alkalosis. And here's the last one for you. Today our pH is 7.49. So on our PaCO2 is 48. Our on the respiratory side, our HCO3 is 38 on the metabolic side. So who are we going to call? Think about it and write it down. Yes, that's uncompensated metabolic alkalosis. All right. Well, that's the end of those. Thank you for listening. Well, hopefully that was useful to you. Now, as some of you may know, I was able to pass my PCCN test recently, or at least a couple months ago. And
Some of the questions that are on your PCCN test are similar to some of the ones that are also on the CCRN test are about blood gases. And so I'm just going to give you a few clues on how to look at some of the questions that would come up. Now, what I noticed in the PCCN exam was that the question, if it was about blood gases, if it wasn't giving me the actual values and then asking me what it was, and I had to answer whether it was a metabolic acidosis, alkalosis, or etc., it would give me examples of things. One example would be a person who came in and was withdrawing off of alcohol. What type of blood gases would you expect? Now, the clue is in the question. So, and what it'll typically do is it give you like there's always four answers down there, and it's going to give you 4 different blood gases. And so one way of figuring out, well, which ones you can eliminate is by figuring out, well, what does alcohol withdrawal cause? Well, alcohol withdrawal causes a metabolic acidosis. It actually causes a ketoacidosis, but if you want to look at it, it's a metabolic acidosis. So that's giving you an answer to 2 of what your blood gases will be. You know it's going to be an acidosis, so your pH is going to be acidotic, so it's going to be on the acidotic side. And you know that your metabolic is also going to be acidotic, so your metabolic is also going to be on the acidotic side. Now, so what you'll do is when you look in your question is you'll look for the 2 things that make your pH acid and your metabolic or your HCO3 acid as well, and that will help you narrow down some of your choices. There are some other examples as well, and really you have to think about your body systems when it asks you this. For example, one question might be a person comes in vomiting. What would their blood gas look like? And you think, well, what has blood gases got to do with vomiting? Well, vomiting can change your blood gas levels, as well as diarrhea can change your blood gas levels. And an easy way to think about this is, well, what part of the body is it talking about? If it's talking about vomiting, it's talking about the upper GI. So if it's talking about the upper GI, what am I getting rid of when I vomit? Well, when I vomit, I'm mostly getting rid of acid. So if I'm getting rid of the acid, what am I left with? So I'm getting rid of my acid, so it's not an acidosis, it's an alkalosis. And because it's to do with an internal organ such as that, it's going to be a metabolic. So it's going to be a metabolic alkalosis. And so if I'm getting rid of the acid, I'm getting, only thing I got left is my alkali. So I'm having a metabolic alkalosis. Well, let's take this another example. The question is, let's forget about the example. So I've got 2 things in my metabolic alkalosis. So I know that my pH is going to be alkali. So I'm going to be looking for an alkali pH. So my pH isn't going to be normal. And my metabolic side isn't going to be normal as well. That's going to be on the alkalytic side. Now, one of the things that I did when I took the test is you're not allowed to take any paperwork or anything in with you, but they do give you a paper and a pencil. And one of the things I did was I wrote down or drawed out my normal blood gases, and we've talked about that in the videos. And what I did is I just wrote down my pH line. You remember the pH town? I wrote out my pH line. And so 7.35 to 7.45 with line up the center at 7.4 and put acid on the left and alkali on the right. And then as the questions came up about blood gases, it helped me answer these questions. Now, let's take this the opposite. What about if a question was to ask you, what type of blood gas would they have? A person has come in and they've been having diarrhea for the past couple of days. What type of blood gases would you expect them to have? Now, one thing to remember is metabolic happens slowly, as to where respiratory happens quickly. So your HCO3 is a little bit slower than your respiratory. But it's talking about diarrhea. So one way to remember this is the top side of your body is your stomach, which is mostly acid. The bottom half of your body, where everything is, been put into waste, is alkali. So if you're having diarrhea, what are you getting rid of? Well, you're getting rid of the alkali side. So if you're getting rid of the alkali, then your alkali is going down. So your acid are higher. So what is it going to be? Well, it's going to be, because it's your stomach again, it's going to be your metabolic side, and it's going to be an acidosis. Because you're getting rid of your alkali, and the only thing you have left is the upper GI, which is your acidic side. So you're going to have more acid than alkali, so it's going to be an acidosis. So that's giving you 2 of your parameters again. So if you have 4 questions down there, you look and eliminate everything that doesn't match 2 of your parameters. And almost always it's going to leave you with 1 answer. So remember, like in this scenario, it's a metabolic acidosis. So your pH has got to be acidic. Your HCO3 is also got to be acidic. So what you would do is look at those 4 blood gases. First, take your pH. Every pH that isn't acidic, eliminate that. And that will usually give you down to 2. And then look at your HCO3. Well, every HCO3 that's not acidic, eliminate that. Well, that usually eliminates it down to 1 answer. And the rest of the blood gases are usually neither here nor there. They're usually as a result, because it can change your oxygenation and stuff like that. But you will notice that in these videos and in my video that I did for you, that I didn't concentrate on the oxygenation. Oxygenation does affect your blood gas, for sure it does, but and sometimes your blood gases can affect that, but it is not one of the things that when you look at the blood gases, like I showed you, that a quick way of being able to determine whether it's metabolic acidosis or respiratory acidosis is by looking at your pH and matching them to whether you're at, say, your HCO3 or your respiratory side as well. And so hopefully this will have benefited you. If you're new to my channel, please subscribe. If you like this video, please like it. Please press the like button, that's what I mean. And if you have any comments or anything that you would like to say, leave a comment below and I will try to get back to you. Thank you very much. This is Ray Upchurch, and I will see you next time.